I think about healthcare often as something that could be tailored more to meet people where they are. One of the reasons that I believe so strongly in that is that as someone who is a part of a community of women who walk together, we're there in sickness and health. We celebrate our accomplishments and we hold each other up when we're feeling weak. It matters that we have each other, and we all need that. Certainly those who are more vulnerable when they have chronic illness. I'm Margo Brooks-Carthon, and I am the Executive Director of Thrive. Our goal is to deliver care aligned with the needs of individuals insured through Medicaid following a hospitalization. Now, I can tell you that I didn't know much about innovation per se, but I've been a nurse for over 20 years. And what I was seeing in my community where I grew up, in my clinical practice as a nurse, is when you're going home and you have to procure resources after hospitalizations. You're basically negotiating what you can do when you go home. Do I get this medication and take care of my chronic condition, or do I take care of my rent? Folks from economically disadvantaged backgrounds are making those hard choices all the time. By the nature of hospitalization, you have 24-hour medical care. And so patients go from a really high level of intensity to home, where you're by yourself, many times without adequate support. Older minorities, those with lower incomes, they don't fare as well. Over the course of 90 days, those who were insured by Medicaid represented 64% of recurrent readmissions. We noticed that only about 1 in 5 were receiving a home care referral. And as a nurse, I realized that that was an opportunity to improve the outcomes of this patient population. I'm very, very happy that she's going to be getting in for primary care, because that would have prevented that hospitalization. Yes. We can get high-level overviews on the new. I was really feeling frustrated. As it stands, I wasn't alone. Design thinking and innovation became a window of opportunity. I was surrounded by other individuals equally interested in thinking about how we could address health inequity. We spent, nearly 100 hours in the field, sitting with, talking to who we would support with Thrive. And we learned so much that we knew that we needed to converge, which is the beauty of human-centered design. Some of the individuals on our early work group were physicians, and they said, well, what if we extend our supervision into the home? It really was a game changer for us. Within 24 to 48 hours, a home care nurse conducts their initial evaluation. They are the very first clinicians to identify a need for additional support. They are really in a pivotal and prime position. Nurses have a particular emotional contract with society. And so we really regard nurses as being central to Thrive's mission.
Having any pain today? No.
We lost a little bit of weight. If you can't eat a big meal, try to break it down to smaller meals. Sometimes that's easier.
Trying to stuff myself.
Yes, exactly. Home care nurses, they can call back with updates or with questions until thrivers are seen by a primary care provider.
Patients stay at home and stay healthy in their home, opposed to having them not have the needed equipment or supplies or medication, which render them, unfortunately back in the hospital.
She comes here, Miss Pat, what you doing, Miss Pat? I said, Lord, if you was sick, this woman would make you well.
We all need extra support when we come home from the hospital and when we're not feeling our best. But if your resources or social support isn't there, it becomes perilous. And what we try to do is come in as a safety net. We want to be able to walk beside folks who may be experiencing more life challenges to let them know they're not alone. It's not just enough that you were discharged from the hospital and you made it home. We want you to have a good recovery. And that's what it means to thrive.